Hello everyone, I'm Gail Hogan, and today we're going to talk about your skin and how to care for it. Joining me are two dermatologists, skin experts from the Ohio State University Wexner Medical Center, and they are going to give us information about our skin. So we welcome Dr. Jonas and Dr. Patricia Malerich. Thank you both for being here.
Thank you for having us.
I'm going to start by letting both of you tell me a little bit about yourselves and what drew you to decide to study the skin. So Dr. Jonas, let's start with you.
Yeah, well, I'm originally from Cleveland, Ohio, and my dad was a internal medicine physician, so I was exposed to medicine at a young age, and I knew that I wanted to be a specialist when I went to medical school, and I liked that dermatology, we see patients of all ages, from newborns to people over 100, so that was one of the deciding factors for me for choosing dermatology.
And where did you then end up your schooling and things?
Yeah, so I went to medical school and I did my training at the University of Cincinnati. And then after that, I moved to Chapel Hill, North Carolina, where I was in private practice for about 15 years. And then we recently moved back to Columbus, and we're really happy to be close to family. And we love living in this area in Ohio State.
Well, we welcome you back to Ohio.
Thank you.
Dr. Malerich, what about you?
Well, I also grew up in Cleveland, Ohio, and fun fact, Dr. Jonas and I went to high school together. We are both graduated the same year at Magnificat High School in Cleveland. I went to Ohio State Medical School, and I trained out in Pennsylvania, and then I was actually here in Dublin for the first almost decade of my career up in private practice in Dublin, Ohio. So I'm very happy to be back.
Well, thank you for both of you for being here today. And let's talk about the skin as it is viewed as an organ, which I don't even think of it like that, but it is the biggest organ in our body. So Dr. Jonas, why is it important that we take care of it, but also aware of changes in our skin?
Yeah. So the skin, often people say it's the largest organ, and that's true. And I think the first thing that comes to mind is that it has a lot of functions, but it protects your bones, your muscles, and your body. So really, it's important to take good care of your skin so that it can do its job of protecting you. And so we oftentimes, we'll do like skin cancer screenings and things like that, just because skin cancer also is the most common type of cancer in the United States. So that's kind of an important part of what we do.
It is the most common?
It is, yeah. In the United States, of all cancers, skin cancer is the most common.
Okay, so Dr. Malerich, I know you're going to say, sunscreen and all those things as we're talking about skin cancer truly is important.
Right. So, the stat on that from the American Academy of Dermatology is 1 in 5 Americans will be diagnosed with a skin cancer at some point in their life. And every day, I think it was 5 Americans pass from melanoma. So it's really important. Early detection is important, early detection and treatment. Sunscreen is very important. Also coming in to have your screenings, and doing self-screenings yourself is important.
We're getting better, aren't we, Dr. Jonas? I mean, I know my daughter is very careful with her children as opposed to her mother, who is very careful with her children. But when I was young, it was a no holds barred. We sat out there with, baby oil. So we are learning, aren't we?
Yeah, I think so. I mean, I think we, still are trying to sort of encourage people to be outside, enjoy the outdoors, but just with a few guidelines in terms of like trying to seek shade between 10 a.m. and 2 p.m., wearing sun protective clothing, which I don't remember sun protective clothing being around when we were younger. And that just, as a mom, makes my job easier because I don't have to put as much sunscreen on when they're covered with the clothing. And then, avoiding tanning beds. I know in high school and in my young adult years, I used tanning beds, and we know that increases your risk for skin cancer. So it's really good advice to avoid indoor tanning.
Dr. Malerich, we're talking about something that's very important to all of us, which is cancer. So why is it important for patients to see experts like yourself and like Dr. Jonas who have had years of experience?
So sometimes it can be hard to differentiate between a benign mole and a atypical and irregular mole that needs to come off. And we've had, between the two of us, over 30 years of experience seeing patients. And we have tools that we can check things. We have different paradigms that we can see if there is something. And we do biopsy and have the lab check it out. So it's really important to come and see us. Put your mind at rest. It's always better if we check it rather than worrying about it.
How do we keep up to date on our skin care? You had mentioned self-examinations, but could you go further in explaining what does that mean for someone?
Sure. So checking your skin every once in a while. There are areas of your skin you don't always see. The bottoms of our feet, we can get melanomas. Our back, we don't see every day. Looking in the mirror, checking it out. And what we talk about are the ABCDs for patients. A is asymmetry, if a mole looks different on one side than the other. B is border, it's growing out an arm or a leg. C is color, it looks gray, black, a variation of grays and blacks. And the last one's a little bit harder, but diameter evolving. So if you have a mole that you know is changing, then there are the obvious things: bleeding, itching, a spot that's bleeding and has not healed over a few weeks to months.
Dr. Jonas, if you catch skin cancer early, what can be done?
Yeah, I think it's really about early detection. So if you do have a concern, I would encourage you to just call as early as possible. And when you're making your appointment, really explain when you're making your appointment you have a concern about a specific spot, or whether you're interested in a general skin cancer screening, because we want to be able to help you, and we want to be able to help you as soon as you need that help. At Ohio State, it's really important to know that when you call to make your appointment for an examination or treatment, that you will be seen by an expert. You'll be seen by a board-certified dermatologist, somebody that's gone to 4 years of medical school, 4 years of training, tens of thousands of hours of hands-on patient care, somebody who's board-certified, and somebody who also does continuing medical education to maintain that board certification. It's really nice because at Ohio State we have Mohs surgeons who basically treat skin cancer full time. We have an oncodermatology clinic, so maybe if you have an oncologist at the James and you have concerns about your skin, we have people who specialize in that. We have dermatologists who work with rheumatologists, so maybe you have arthritis and your specialist is at Ohio State. It's also a good idea to see an expert in skincare at Ohio State too, because we can work together. We have Dr. Tyler, who has a gynecology and dermatology clinic, so there's a lot of sub-specialized care. In addition to just the regular skin cancer screenings, we offer that as well.
So that team approach is really important, isn't it, Dr. Malerich?
Yes.
Working together with each other, but also other doctors that may need to be contacted concerning a patient?
Correct.
I know that we are ourselves talked about the fact that soon you will be moving to a new location. Yeah. I know you're both very excited about it. It's the new Dublin Outpatient Clinic, and it's beautiful. I passed it the other day.
Yes.
Why are you excited about moving there, Dr. Malerich?
We're excited because Ohio State has provided us opportunity to work in a brand new building, lots of space. It's a multidisciplinary building, so we will have a lab in there. We will have x-ray and imaging in the building. We will also have our primary care colleagues, our OBGYN colleagues, our therapists, lots of other specialties that we're going to work well with together. And most of all, it has great parking, and it's pretty convenient for the people in the location, which has not been served very well in the past by Ohio State. So we're ready. We're going to come and help everyone out.
Are there going to be labs and other types of things there, Dr. Jonas?
Yeah, that's right. So I think we'll have access to a pharmacy. We'll have an access to a lab. So if you have to have your blood drawn, you can just go downstairs. I think we're on the 3rd floor. But it'll be really nice because a lot of patients will have their primary care physician in the same building. Obstetrics and gynecology will also be available. And so we're just excited to be in a big, beautiful new space and state-of-the-art rooms and treatment rooms for surgery. So we'll be offering medical dermatology and surgical dermatology services in Dublin. So this is a really big step for Ohio State to kind of step to the sort of northwest part of Columbus and offer services to patients who really probably didn't want to make the drive down to the main campus for healthcare.
Well, we're talking about patients coming to see you. What type of patient should, Dr. Malerich, should everyone see a dermatologist?
Well, you're talking to a dermatologist. Everybody has skin, so there's no shortage of skin.
But age or sex, or does anything have to do with that culture?
So everyone should have a skin screening. But what we can see more acutely are lesions that are changing. We also treat skin conditions, eczema, psoriasis, certain skin cancers that are sort of rashes on the skin. Any rash we can take care of. And warts. That's always a fun one. But we also treat hair and nail diseases too.
You treat nail diseases?
Yeah, so we treat disorders of the skin, hair. We have a specialty clinic. Actually, I forgot to mention a hair loss clinic at Ohio State as well. And then we do treat disorders of the nails, like it could be brittle nails, like sometimes like pigmentation disorders of the nails. Certain medications that patients take and other health problems can affect the nails. So taking good care of your skin and paying attention to the health of your skin and nails sometimes can also help you understand like your overall holistic view of your health.
I was going to say sometimes that's an indication of something else
Yes,
going on,
that's
right,
true.
Dr. Malerich?
Yeah.
I mean, I don't know what that would be, but it is an
Sure.
indicator.
Well, the skin and the nails and the hair can be a window to your systemic issues. So yes.
How often should someone come to see you if they don't have a specific issue? Should it be a yearly thing for an exam, Dr. Malerich?
So we recommend yearly skin checks with a family history of skin cancer. We recommend it more often than if you do not have one. You can have a baseline. If you're young, we don't find anything, you can go a few years. So usually when you have your baseline, we'll determine with other factors how often you need to be seen.
How can a person get skin cancer on the bottom of their feet if that is never exposed to sun?
Right.
Yeah, we always tell people, I think Bob Marley passed away from like a skin cancer under the nail. So so I think that there are, sun exposure is one of the biggest causes of skin cancer, but there's genetic factors as well. So if you see something and you're not sure, if there's any doubt, please reach out to your primary care doctor, reach out to your board certified dermatologist, and we can kind of offer you expert care. And the best case scenario is we can provide reassurance.
Right.
Yeah.
Yes. And sometimes that is just what you need. Okay,
Yeah.
I feel better now.
Good.
Dr. Malerich, we mentioned a little bit about some of the other skin diseases that you take care of. Can you go into a little bit more depth of things like eczema? How does someone know that a rash is something that needs to be seen by a specialist as opposed to it's going to go away in a day or two?
Well, right. There are some things like fungal infections that look like eczema but actually need to be treated very, very differently. So if you have something that's just persistent, not going away, it's itching, bleeding, causing you distress, it's always good for us to take a look at it.
And when you do that, most of the time, is it topical creams or meds, or there's no surgery usually involved with this, right?
Right, so you don't have to worry. Most of the time, we will take a biopsy if we have to, but we will normally just treat medically if we can.
When we talk about eczema too, Dr. Jonas, is this something that affects babies and all the way up?
Yeah.
What are some of the things we see age-related in people?
Yeah, I'm glad you brought that up because eczema is probably one of the more common diagnoses that we help people with, and most commonly it presents around 3 months of age.
That young?
Yeah, and so we do see children at the time of diagnosis. Sometimes they've already seen their pediatrician and have tried treatment, and oftentimes, it significantly affects the quality of the life of the child because the itching can disrupt eating and sleeping, and then the parents are tired too. So
this makes me sad thinking about it. Poor little thing.
It can be, So that's kind of one of the common presentations. And then also, interestingly, you can really develop eczema at any time. We also see adults. That's not as common. It's more common to present in childhood, but we do treat adult onset eczema. It's also called atopic dermatitis. And there's a lot. It's actually one of the exciting frontiers of dermatology because really in the past few years, 2-3 years, we have so many new medications that we can use, beyond the steroid creams that we've used for decades now.
Dr. Malerich, if you have eczema or another type of skin disorder, will you have that for the rest of your life?
So these are considered chronic skin conditions.
They are.
So you will have flares and kind of silent times of the skin, but it is considered chronic, like psoriasis.
As women get older, we get drier skin. So there's all kinds of different things to think about as we age. Besides the dry skin, Dr. Malerich, what else can we work on ourselves too to help take care of our skin ourselves?
So I always have a very simplified plan.
Good.
I say,
We love simple. Thank you.
Simple.
the 3 things I say are in the morning, you want to wear your sunscreen. Put it in your moisturizer. So that way, if you're wearing a mask or you're wearing makeup, you still have sunscreen for the time when you're in your car. Secondly, at nighttime, I want to use a gentle wash on the face and moisturize. Moisturize is very important. And then at bedtime, if you want to combat damage we've had from sun and stuff like that, I suggest some form of retinol or Retin-A.
When we're talking about hair, the same thing, Dr. Jonas, what should we do? And this is where many people self-diagnose. Okay, I have a little dandruff, I'm going to get a dandruff shampoo. But when is that something that, that might need some more help from you?
Yeah, I think that a lot of times patients will have already tried some of the over-the-counter. So they have like selenium, sulfide, zinc, salicylic acid. When you go to your favorite store, there's a lot of different active ingredients in the over-the-counter shampoos. I always sort of instruct patients to use the shampoo as thinking of it as washing your scalp and not your hair, because really the goal of using a shampoo is to help remove some of the oil, dirt, bacteria, and things like that are on the scalp. For your hair, I always try to focus on conditioner and protecting the ends of the hair. You don't want to get conditioner on the scalp. But that's kind of how we sort of, that's always a starting point. And oftentimes if you've tried and failed those things, that's a great time to come and talk to us, because there are prescription shampoos and there's topical preparations that are prescription that can really help kind of address the inflammation, because that's actually a really common diagnosis as well.
You talk about this being chronic, Dr. Malerich. Is there anything people can do to prevent these things from coming back or from flare-ups? Or is it just part of your DNA? If you have it, you have it, you know?
Well, for eczema especially, we talk about barrier prevention. So meaning keeping the top layers of your skin intact. So when it is dry outside or you're taking hot showers, make sure you're moisturizing when you get out of the bath or shower right after, so the body kind of soaks that in and repairs the barrier. Any break in the barrier could cause an eczema flare. So really keeping on top of moisturizing.
Yeah.
You know, it's interesting too, Dr. Jonas, is people say, well, I live in Ohio. I really don't need sunscreen because we really don't get a lot of sun in Ohio.
Yeah.
It's not Florida. It's not Arizona.
Yeah.
But even when there's no sun or there's clouds, can we still get those rays that affect us?
Yeah, and I think because we just haven't had, any sun, we're all so fair, and then spring hits, and so, the first sunny weekend of every, like spring, everyone comes in for their skin exams with a sunburn because, it's just you're not quite ready for the intense sun rays that can happen here in the spring and in the summer. I do warn patients, because I think if you're going to be, on the sands, like on the water, or even snow, like a lot of patients go skiing and sometimes come back surprised that the reflection of the ultraviolet light, even in cloudy conditions and things like that, can sort of magnify the effect on the skin. So it's just something important to think about, really all year round.
And Dr. Malerich, we'll end with this because I think people will be curious if you do aesthetic services at Ohio State as opposed to just diseases of the skin.
So we'll do some at Ohio State, but we also have an office, our New Albany office, and our Gahanna office that have multiple lasers, and they will do the fillers, the Botox, that. I think we'll do some Botox at our Dublin office, and we will have some lasers, but not a full comprehensive. Would you agree with that?
Yeah.
Well, thank you both, and we want to let everyone know that the new Dublin office, or your Dublin office, the Dublin Clinic, will open August 3rd, so we're looking forward to that. And we want to let everyone know how they can get an appointment with you. For more information about the services that we've just talked about being offered in Outpatient Care Dublin, including dermatology that we've just mentioned, go to Wexner Medical. This is a website, wexnermedical.osu.edu/Dublin. And to schedule dermatology appointments, call 614-293-1707. You see that right on your screen. Dr. Jonas and Dr. Malerich, thank you so much for joining us. And thank you all for joining us today as well. It's been a pleasure to see all of you and to hopefully help you with all those questions you have about your skin. So thank you.
Thank you.
Thank you.